Can transverse myelitis turn into MIS? Have you ever wondered if transverse myelitis can lead to multiple sclerosis? This is a question that many people ask, especially those who have experienced the symptoms of transverse myelitis. Transverse myelitis is an inflammatory condition that affects the spinal cord, causing a range of symptoms like weakness, sensory changes, and problems with bladder or bowel control. It can happen as a single event or as part of a more complex disease process. Now, let's talk about multiple sclerosis, often referred to as MIS. This is a chronic autoimmune disease that leads to inflammation and damage to the protective covering of nerve fibers in the central nervous system, which includes the brain and spinal cord. MIS can cause a variety of neurological symptoms that can change over time. So, can transverse myelitis evolve into MIS? The answer is yes, but it happens in a minority of cases. Research shows that about 13% of patients diagnosed with idiopathic acute transverse myelitis may develop MIS over a median follow-up period of around 3 years. This conversion is more likely in younger patients and those with specific MRI findings, such as lesions that are typical of MIS. When we look at the relationship between transverse myelitis and MIS, there are some important points to consider. First, transverse myelitis can sometimes be the first sign of MIS. If someone experiences a partial episode of transverse myelitis, they may have a higher risk of developing MIS later on. In fact, studies suggest that those with partial transverse myelitis have a risk of up to 80% of developing clinically definite MIS, while those with complete transverse myelitis have a much lower risk. MRI findings also play a crucial role. If brain lesions typical of MIS are present during the time of transverse myelitis, the likelihood of progressing to MIS increases. On the other hand, extensive spinal cord lesions are often linked to other conditions and do not necessarily indicate MIS. Other factors can influence the risk of developing MIS after transverse myelitis. These include the age at which symptoms first appear, specific immune markers found in the cerebrospinal fluid, and certain antibody profiles. Recovery from transverse myelitis varies widely among individuals. Many people do see some improvement, but those who go on to develop MIS may experience additional neurological episodes over time, which reflects the relapsing nature of MIS. It's essential for anyone diagnosed with transverse myelitis to be evaluated by a neurologist who specializes in demyelinating diseases. This evaluation can help determine the risk of developing MIS and guide appropriate management. Regular neurological exams and MRI scans can be crucial in monitoring for new lesions that might suggest MIS. In summary, while transverse myelitis can turn into multiple sclerosis, this occurs in a minority of cases and is influenced by various factors. Understanding these nuances is vital for anyone experiencing symptoms related to transverse myelitis. Always consult with healthcare professionals for personalized medical advice and management.